Drugs for hyperthyroidism. First, we have drugs that will inhibit the synthesis of thyroid hormone. These are known as antithyroid drugs, like propylthiouracil, also known as PTU. The alternative to propylthiouracil is methimazole, carbimazole. So these drugs, they will inhibit the synthesis of thyroid hormones. What do they do? They inhibit thyroid peroxidase enzyme. Thyroid peroxidase enzyme, it is an enzyme involved in the synthesis of thyroid hormone. It is responsible for the oxidation of iodide to iodine. So by inhibiting thyroid peroxidase, these drugs will reduce the synthesis of thyroid hormone T4 and T3, and these are used in the treatment of hypothyroidism. So drugs that inhibit the synthesis of thyroid hormone is propylthiouracil, methimazole, carbimazole. They do so by inhibiting the enzyme thyroid peroxidase. Then drugs that will inhibit iodide trapping. Okay, iodide trapping means the uptake of iodine. So there are certain drugs which will interfere with the uptake of iodide by the thyroid gland, and thus they will reduce the production of thyroid hormone. So these drugs that will inhibit thyroid production by inhibiting iodide trapping are thiocyanate, perchlorates, and nitrates. Thiocyanate, perchlorates, and nitrates, they inhibit iodide trapping or ionic inhibitors. They are known as ionic inhibitors, thiocyanate, perchlorate, and nitrates. So they are rarely used because of potential toxicity. So these ionic trappers, ionic inhibitors, they are rarely used because of potential toxicity. Then the drugs that will inhibit hormone release. Okay, there were drugs that were inhibiting synthesis. Then drugs that inhibit the release from the gland, they are iodine, iodides of sodium or potassium, and organic iodide. So these iodine solutions or iodides of potassium and sodium and organic iodide, they will inhibit the release of the hormone. High doses can temporarily inhibit the release of thyroid hormone from the thyroid gland. These drugs are used in thyroid emergencies or for preparation of the surgeries. So iodides or organic iodide or iodide of potassium and sodium, these are used in thyroid emergencies or for preparation of the surgery. Then there are certain drugs or radiations which will destroy the thyroid tissues. So these are known as radioactive iodine. Radioactive iodine, they will destroy the thyroid tissue. That is 131 iodide, 125I, and 123I. Radioactive iodine example 131I, 125I, and 123I. They will destroy the thyroid tissue. Radioactive iodine, they selectively accumulate in the thyroid gland and damage the thyroid cells. So they are used for treatment of hypothyroidism or thyroid cancer. So drugs that inhibit the synthesis of thyroid, they are polythiouracil, methimazole, and carbimazole. The drugs that will inhibit iodide trapping are thiocyanates, perchlorates, and nitrates. The drugs that inhibit release of the hormone are iodine, iodides of potassium and sodium, and organic iodide, and radioactive iodine. They will destroy the thyroid tissue.